Hi, I'm Dr. Angela Yankee.
And I'm Dr. Kathleen O'Neill Smith.
Welcome back to the FIRRIMup Doctors, Good Medicine docu-series.
We are so glad you joined us.
We want to provide you with credible health resources, guide you in your treatment options, and fire you up to take control of your health.
Hello, everybody. We are so happy you've joined Dr. Kathleen O'Neill Smith and myself. She's actually here live in Gainesville, Florida with me.
And so wonderful to be here.
Yeah, and we have two special guests I'll introduce in just a minute, Dr. Marguerite Wayne and Dr. Cabeca. But we have launched into this month pursuing wellness and really talking about wellness. Next slide. We're actually talking about something really important today. We're talking about the association between oral contraceptive medications and breast cancer with two leading women's health experts. Thank you guys for coming. But I will invite you to mark your calendar. Next week, we're actually doing a COVID update. We promise we do a COVID update once per month. And next week, it will be with Dr. Ian White. He is a scientist in regenerative medicine. And we're going to be reviewing an article published by Dr. Anthony Atala of Wake Forest, a lead in regenerative medicine, on studies having to do with treatment of COVID cytokine storm with regenerative medicine therapies, such as mesenchymal signaling therapies and non-cellular therapies. So that'll be really, really interesting.
I can't wait for that.
That's going to be really fun. So without further ado, I'd like to introduce Dr. Marguerite Wayne, who is a friend of mine, actually. She's an expert on fertility awareness-based methods of natural family planning. And she's board certified in family medicine and adjunct associate professor at Georgetown. She is co-founder and executive director of FACTS, Fertility Appreciation Collaborative, to teach the science in medical schools. I came to one of your conferences a couple of years ago. Thank you. It's excellent. She's trained as a Creighton model and a FEM medical consultant, as well as a Teen Star educator. She also works with modern mobile medicine, direct primary care house calls-based medical practice that serves patients of all ages in the DC area. Dr. Wayne received her medical degree with recognition in primary care from SUNY, State University of New York at Stony Brook, and completed her family medicine residency at Lancaster General Hospital in Lancaster, Pennsylvania. So thank you so much for coming, because to me, you are the world expert in fertility awareness-based methods of family planning, because we're going to be talking about what we alluded to last week with Dr. Cabeca, that it's known that oral contraceptive medications increase breast cancer risk, but I didn't want to leave it there. I wanted to offer a plan or a treatment plan other than oral contraceptives. So thank you for coming.
Thank you very much for having me. I'm excited to be here with you all.
Yeah, thank you for doing the work that you do. I remember a long time ago reading in Spare Off with the GYN guru in medicine that oral contraceptives cause breast cancer, but nobody ever mentions that in med school, do they? So this is really exciting to have you here, and I really thank you for the work you do.
You're welcome. Thank you for having me. I'm glad to be here.
She works tirelessly and has not-for-profits going. She's got a big family. I mean, my goodness. Next, I'd like to reintroduce my friend and colleague, Dr. Cabeca. We convinced her to move a meeting that she had here because she was with us last week because of this important topic. She's a leading women's health expert and best-selling author of Hormone Fix and Keto Green 16. To me, she's a pioneer in hormones, hormone management, and what's best for women. She herself has many daughters in her life and a huge following on social media. So everybody listens to Dr. Anna. So I so appreciate you coming to discuss this topic that you actually brought up last week when we were talking about postmenopausal hormone replacement in breast cancer. You mentioned the association between oral contraceptive medication and breast cancer.
Well, it's great to be here again with you. Great company. So thank you guys for having me again. It's such an important topic. Great to meet you, Dr. Marguerite Wayne. It's so nice to see you here as well. Looking forward to this conversation.
Anna, thank you for coming back. You're the best.
2 weeks in a row, and we know how busy you are.
I love you guys. This is, you are on the edge, right? Cutting edge, and it's important to bring this information out, just like last week. So if anyone's listening, didn't listen to last week, that's such important. That should have made front line, headline news. And we need to really spread the word about this too, because when it comes to oral contraceptive pills, even in perimenopausal management, it's often a treatment of choice, but yet we're aware of the risks, especially with oral hormones. And so, yeah, thanks for bringing this important topic to the forefront.
Well, I think one of the big things is nobody really talks about this as a risk. Nobody, I mean, are you guys familiar with doctors that talk about this as a risk? I don't think so.
No,
So I think
not
it's
at all.
important. I'm glad that you guys are doing this work and you're on the cutting edge. So it's wonderful to have you here.
Well, and I think it's really important, like, how do we know all the different birth controls? As an OBGYN, the only way I learned about, like all the varieties that come into your office to give samples of, right?
Mm-hmm.
And the last thing they're saying, well, this is increasing the risk of breast cancer, this amount, or this is the safest form of, oral contraceptive. We don't get that type of introduction. So you really need to look at the research and be aware, because it's not coming through your physician's doors.
No,
Right.
it's really, really important. And this
Absolutely.
is a study here from 2017, the New England Journal of Medicine, basically looking at hormonal contraception or oral contraception and the risk of breast cancer. And here they took 140 million women worldwide who use oral contraception, and that between the ages of 15 and 49, and just as they write about in the book, and Sparrow's book on GYN, the risk of breast cancer is higher among women who use currently or previously have used hormonal contraceptives than among women who had never used them. And the longer the duration of the usage, the increased risk. And that's what's demonstrated down below. So in 1.8 million women who were followed for almost 11 years, there were 11,500 cases of breast cancer. That's a really big deal. That's a lot of people. Of course, it's out of a lot of 1.8 million, but it doesn't really matter. That's a lot of young women who end up with breast cancer because of oral contraception. So compared to women who had never used oral contraception, the relative risk of breast cancer among all current and recent users of contraception was 1.2. So there's a 20% increase risk, and that's a very, very substantial. So if you look at people who have used oral contraception for less than 1 year, a short time, their risk was up 1.09, and compared to using oral contraceptives for more than 10 years, 1.38. So here we have 3 different numbers here, but all of them are pointing to an increased risk of breast cancer. So what do we do? I mean, I do not enjoy having this conversation with young people, because if you have this conversation with young people and they can just pop a pill, 30 days a month, they're much more apt to do that. But this is a very serious consequence. And they're not really thinking that this is going to happen to them, that they're not going to be one of those 11,500 people. So what do we do? What do you guys recommend? Next slide.
Dr. Marguerite Wayne.
Well, this is what my passion is about educating and empowering those young women. I mean, like you said, the majority of women, and it's a lot of young women, start using OCPs at a very early age. The majority use it to prevent pregnancy, but there are a lot of girls and young women who are starting it for other reasons. They're often commonly prescribed this to treat their irregular periods or their painful periods or their PMS symptoms, their acne, etc. It's a wonder it's such a quote unquote miracle drug. And as medical students and young physicians, we're often trained to believe that the pill is the panacea for all that ails women, without really fully understanding that the World Health Organization classifies combination hormonal birth control pill as a group 1 carcinogen. It's in the same category as tobacco and asbestos because of the increased risk of cancer, specifically breast cancer and cervical cancer, as well as liver cancer. So what do you do? Again, the majority of women use these methods for family planning purposes and to treat medical conditions, but there are other safer, healthier, side effect-free ways to plan for your family. And as an expert in fertility awareness, this is what my mission is through my FACS organization, is to educate our colleagues about the science supporting fertility awareness-based methods. With these methods, and there are many of them, women learn to observe specific signs that reflect internal hormonal changes that happen in her body every month. so she can identify where she is in her cycle and whether or not she may be fertile or not. One of the things that is shocking for women when I explain to them, you can't get pregnant every day of the month. You're not fertile every day out of your cycle. In fact, your window of fertility, those potential days when you could possibly become pregnant, is very narrow, typically ranging from only 3 to 6 days. So about 20% of the time, women are fertile or capable of getting pregnant. So it begs the question, why are we advising them and encouraging them to take a birth control pill every single day to suppress their reproductive health system when they're only fertile for a short period? Go ahead. So with it, what are the signs women can observe? Depending on the method, women can learn to observe cervical mucus or fluid secretions. She can learn to observe her basal body temperature as well as urinary hormone measurements. So can we go to the next slide, please? This picture is really just designed to show you how the female cycle is this intricate orchestration of hormones that are produced in the brain and the pituitary that affect the ovary and the developing follicles that produce estradiol and progesterone. It's this incredible symphony of hormones that result in ovulation every month that also results in these observable signs, specifically the changes in cervical fluid, as well as the rise in basal body temperature. And at the bottom, you can see how women can learn to chart these signs. She can chart her menses with red stamps, days of dryness when she doesn't notice any mucus observations with green stamps, and days when she observes fertile type mucus with white stamps with babies. And that baby figure is designed to basically be a visual trigger for her to understand, like, this is a potential day when a pregnancy can occur. Again, when women learn from a trained instructor in any one of a number of methods, whether it's the Billings ovulation method or Creighton or symptothermal methods or Marquette, women can learn to observe specific signs to identify that window of fertility. And together with her partner, they can make a decision. Are they trying to get pregnant? Are they trying to avoid pregnancy? And plan accordingly. Even single women can use these methods simply for the perspective of better monitoring and understanding our health. And if women have issues like PMS or painful periods, the chart can often provide play a role as an important diagnostic tool or as a fifth vital sign to help women better understand, track, and work with trained physicians trained in FABMs to be able to manage these more naturally. Can we go to the next slide? So I mentioned a few of the different natural methods of fertility awareness. And what I want to start out with by saying is that modern fertility awareness-based methods are not the rhythm method. The rhythm method was developed in the 1930s, nearly a century ago, 30 years before the first birth control pill was on the market. And at the time, it was a major scientific advance. But since then, the Billings method was developed in the 1960s, Creighton in the 70s, symptothermal in the 70s, symptohormonal methods were developed in the 80s and 90s. And all of these methods are based on the latest research. And you can see the effectiveness rates, both with correct and typical use, are comparable to the oral contraceptive or birth control pill, and in many instances, better than condoms. So modern methods of fertility awareness are not your grandmother's rhythm method. They are based on the latest scientific research. And when women or couples learn to use them, they can use them very effectively. Next slide, please. And again, I want to emphasize, women may be taking birth control not only for the point of family planning, but often they're given it because they have polycystic ovarian syndrome, which causes them to have irregular cycles. And they're told, well, if you take the birth control pill, it will regulate your cycle. Well, in fact, the birth control pill does not regulate a woman's cycle. It suppresses her normal hormonal development by taking synthetic hormones. And then when she stops taking them for that placebo week, she has what's called a withdrawal bleed. Polycystic ovarian syndrome is a condition that not only affects the woman's reproductive health cycle, but it also affects her metabolically. The pill merely helps to address the symptom of the irregular cycles, but it doesn't get at the underlying cause. Similarly with premenstrual syndrome, it's thought that premenstrual symptoms are due to a rapid fall in progesterone, the hormone that is dominant in the second half of the woman's cycle. And when that drops off rather quickly, women can experience increased irritability and anger and fatigue and bloating. By giving women the birth control pill, it doesn't, again, address that insufficiency of progesterone. It shuts down her hormones entirely. With fertility awareness-based methods, women can learn to chart their cycle, identify when they're entering into that luteal phase, and simply take bioidentical progesterone to help manage those symptoms. With all of these conditions, fertility awareness-based methods can play a critical role in helping it getting at the root cause. Dysmenorrhea is often caused by endometriosis, and again, many women are given birth control pills to treat endometriosis. And while it will certainly reduce the pain, it does not get at the underlying root cause. With fertility awareness-based methods, the goal is to educate women about the way their bodies work, to empower them with this information so they can truly take control and take charge of their fertility and of their health. So I strongly encourage every woman, whether you're 45 or 15 or anywhere in between, to learn about how to chart your cycle with a fertility awareness-based method. The best way is to learn from a trained instructor. There are many apps on the market, and those are available, and I think great tools to facilitate tracking, but it's always best to learn from a trained instructor.
I would love for you to go over tracking, Dr. Dwayne. Could you go over that? Because this is really, I mean, this is so good. It's so, I want to know what the gold standard is.
Yes. So again, you know, we talk about there are many different methods, and people always ask me, which is the best method? And I tell them the best method is the one that's going to work best for you. You know, for a young girl who's 13 or 14, like my daughter, I'm going to teach her simply to chart her cervical mucus. I tell women it's as easy as remembering to wipe when you go to the bathroom. Every time you go to the bathroom, you want to wipe beforehand and pay attention as that toilet paper, you know, runs across your genital area. Is it dry? Is it wet? Is it slippery? Look at the tissue. Is there mucus on it? Does it look clear? Does it look white? You write these observations down on a daily basis. Some women like to cross their T's and dot their I's, and they need a double check. So checking your basal body temperature every morning, you turn off your alarm, you put the thermometer in your mouth, and you write down your temperature. In the first half of your cycle, your temperature is going to be about a half a degree lower. Once you see that rise of a half a degree in your temperature, you can safely know that ovulation has likely occurred and you have now entered into your second infertile period. So depending on which signs you want to track, most of the methods do involve tracking cervical fluid, but others will combine it with temperature and urinary hormones as a way to give you a second confirmation of where you are in your cycle and whether or not ovulation has occurred. This is a learned skill, and I tell people fertility awareness-based methods initially can be challenging. It's like riding a bicycle. I mean, how many of you have young children, or you yourself remember learning how to ride a bicycle? And in the beginning, you're like, I don't know how I can balance and steer and not fall off. But once you learn how to ride, you can't remember what it was like not to ride. So learning to chart your cycle in the beginning, you have to get into the habit of checking your cervical mucus, you know, throughout the day, perhaps checking your basal body temperature every morning, writing down those signs, and then learning how to interpret them. And then again, that's where a teacher is so helpful. So you have somebody you can go back to. It typically takes, on average, women about 2 to 3 months of tracking before they feel fully confident in identifying their fertile window. And using that information, again, depending on their family planning goals, if they're trying to prevent pregnancy or to achieve pregnancy. I always like to say fertility awareness-based methods are true methods of family planning because you can use them to plan when to have a family and when not to expand your family, depending again on your goals. And the most amazing thing is these external signs simply reflect the internal hormonal changes that are happening in your body. Yeah. So you have the power in your hands to understand your hormones by tracking your cycle using any one of the modern fertility awareness-based methods.
Dr. Anna, you have another question?
Well, yeah, I just say, so with that, kind of thinking, okay, training our, you know, our youth, when this whole concept of the time you are fertile. So you're wiping every day. I think that's a great visual, and you're getting to know your body's fluid. You're looking for that thickening, clearish cervical mucus or white, you know, like a more of a creamy white discharge. Then that's going to tell you like how many days you're fertile for.
Yes. So it depends on the method, how you do your fluid interpretation. Fertile type mucus, I tell women, it looks like raw egg white. So if you've ever made an egg, you crack it open, you see the clear, stretchy, it feels very slippery. You can learn to identify it. Some women do suffer with like a chronic discharge, but women can learn to observe what's their baseline discharge, what some methods refer to as your baseline infertile pattern. It might be a thicker type mucus with a off color, but you begin to notice the change from the basic infertile pattern to the more fertile type mucus, again, which tends to be more clear, stretchy, or lubricative or slippery in sensation. So again, depending on the method, you will learn from your instructor how to make those observations of cervical mucus and how to interpret them to identify that window of fertility, that is when you're capable of becoming pregnant. As Dr. Atkins said in the introduction, I'm trained as a Teen Star educator, and through the Teen Star program, we teach young girls how to chart their cycle. Again, not from a family planning perspective, but to understand what's happening in their bodies so that they can be prepared and be able to anticipate when they're going to get their period and not be caught off guard by that fact. So they can understand the emotional changes they're experiencing and see how it correlates to where they are in their cycle. Again, so this isn't such a mystery to them, but it's a window into what is happening within their bodies on a daily and a monthly basis as they go through their cycle.
Such a wonderful way to empower women, young women, to really understand and be able to be out in the world with everything else that's going on and feel strong and feel like they know their body. They're not guessing.
And it's amazing because we're seeing interest in this from women from all walks of life, not only married women or women in relationships, but from young women, from women who approach this from a faith-based perspective or a secular perspective, women who are just tired of the artificial hormones, women that, will spend extra money on organic food that doesn't have hormones and then are like, well, why am I taking a pill that's full of synthetic hormones if I'm trying to avoid that in my food? And my response is like, yes, there are ways. And, there are more and more documentaries being done about the harms of birth control and about fertility awareness as a healthy alternative. Now, again, because this requires learning a new skill, it requires behavioral modification every month if you're in a relationship, making that decision. It can be more involved and more challenging to use, but if you have a supportive partner, you learn from a trained instructor, and you're motivated to make your observations and interpret them and use them correctly, you can use these methods very effectively.
So typically, how many days are we fertile per month? So
that is a fantastic question. And I always phrase it or frame it depending on the patient's goals. So physiologically, the period when you are actually physically able to become pregnant is 3 to 6 days, at most 7 days. But when women are learning to chart, if they're using a method to avoid, I tell them the practical period of fertility can actually range from 8 to 12 days, depending if you have a chronic discharge pattern or if you don't have a distinct temperature rise where you can confirm ovulation. So even if it's 8 to 12 days, that's still only about 25 to 30% of the time. And the reason why I said it depends on the patient population is when couples are struggling with infertility, it helps them to understand that window of potential time when they can get pregnant is more narrow, and they really need to focus their times of sexual intercourse during that fertile window. And again, this information can be so empowering. I had a young couple that I cared for as a physician. She was 27 and he was 31. So they certainly were not of advanced age where they would be at increased risk for infertility, but they had been trying for over a year to conceive. So by definition, clinically, they met the criteria for infertility. And the woman thought that there was something that was wrong with her because her husband had a child from a previous relationship. So in her mind, her body was broken and what could we do? And in getting her history, she described this regular infection that she would get almost monthly, she said, when she would get this discharge. And she said whenever she got this infection, she would avoid having sex with her husband because she thought it was something that was a sexually transmitted disease. And she didn't want to give this to her husband. And in taking her history, the discharge that she was describing was her normal fertile cervical mucus that was produced under the influence of estrogen when she was entering her fertile window. So every month she was deliberately avoiding having sex with her husband during her fertile window. And after testing her for STDs and doing a full workup, I was able to reassure her, you do not have an infection. What you have is normal fertile cervical mucus. And this is when you want to have sex with your husband if your goal is to have a baby. And I encouraged her, don't be afraid, go with that, and engage in sexual relations then. They came back 3 months later pregnant, thinking that I was a miracle worker, but all I really did was empower her with information about how her body works. But she was avoiding sex during that narrow 3 to 6 day period because she didn't want to give her husband what she thought was an infection. So to answer your question, the physiological window, the potential days when a woman can actually become pregnant is only 3 to 6 days. But if couples are using this and they have serious reasons to prevent pregnancy, the practical time when they may need to avoid sexual relations is 8 to 12 days. Now, some methods may advise or allow for the use of barrier methods during the fertile window. And that is certainly the patient's choice, but I think it's always important that you inform the patient that the only time barrier methods are going to fail is when couples use them during the fertile window. So I showed on the previous slide that condoms have an effectiveness rate with typical use of 82%, but that was when they checked the use of the condom throughout the cycle. If they're only using a barrier during the fertile window, they're really adopting the effectiveness rate of the barrier method because they know they're fertile and they're relying on the condom or the barrier to prevent pregnancy. And so effectiveness rates may be lower. My belief is that we simply need to give women this information so that they can understand and make an informed choice with regards to their family planning goals.
Yeah, well, I think it's really good because this always gets a question that we get. Okay, when can we get pregnant? When do we avoid? When's the safest time to have sex and not get pregnant? Right? Like, for example, during our periods. But again, how long is your period? How long is your cycle? I mean, all of those factors come into place. But I know I read an article and said, oh yes, you can get pregnant during your period. I mean, that is highly unlikely. I mean, if you have maybe a 21-day cycle and a 10-day period, I mean, but otherwise, I think this is really important.
It is highly unlikely, but you're right, if they have a short cycle. But I tell people, and I've had couples where the wife has a very serious health reason where a pregnancy would endanger her life, where they cannot get pregnant. And I tell them the only time these methods will fail in that, they will not be effective to prevent pregnancy is when you engage in sexual relations before you can confirm ovulation. And that can happen, during the period if you have a very short follicular phase. So for couples like that, I advise them to use a method where they can confirm ovulation. That gives them a longer period when they may not be able to engage in sexual relations. But once they confirm that they've ovulated, either by the distinct change in cervical mucus, rise in basal body temperature, or change in urinary hormones, I tell them, you can have sex all day, every day for about a week and a half, and you are not going to get pregnant. So, and actually the research shows that couples that use natural methods of family planning have just as much sex, if not more sex, than couples that use birth control methods. But people that use birth control may have sex every third day, whereas couples that use fertility awareness may have sex a couple times in the first week, and then the third and fourth week, they may have sex every other day. So it happens at a different sequence, so to speak. But the incidence or the amount of sex that couples have using fertility awareness-based methods is on par or more than couples that use birth control. And part of that is,
Dr. Wayne, it really does require cooperation with the partner, right?
It does.
We did a study where when couples use this method, the divorce rate is down because it requires so much cooperation and communication.
Yeah, I like to tell people when you can communicate to your partner about your cervical mucus, there's really not a whole lot that you can't talk about. I mean, it really breaks down those barriers of things that are challenging to have conversations about, but it does. And it really highlights that, for 50 years, women have bared the brunt of the responsibility for pregnancy prevention. But the truth of the matter is it takes two people to make a baby. And as such, it really does take two people to prevent pregnancy. And these methods are very egalitarian. I mean, they require both input from both partners to play a role. It can be more difficult because when couples if they're trying to prevent pregnancy, when they need to avoid sexual relations is when the woman's estrogen is the highest. So her libido is the highest. She's like most physically attractive and appealing to her partner. So it really does require self-restraint on both parties, but it can be done and it can strengthen the relationship. Abstinence gets a bad rap. And, so I tend to not even use the word because people are like, oh, I don't want to have to abstain. And, I tell people abstinence basically refers to refraining from a pleasurable activity, whether it's sex during your fertile window, whether it's, dessert in the springtime leading up to swimsuit season. But the reality is when we abstain from something that we enjoy, when we're able to go back to it, it becomes that much more enjoyable. And, you're all based in Florida. And I like to tell the story how one year I got season tickets to Disney World, or an annual pass to Disney World. And I took my kids every 2 months. And by the 6th trip, they're like, do we have to go to Disney again? Sometimes when you have too much of a good thing, you don't really appreciate it as when you have to wait and you're like, you have that anticipation. And couples that use these methods often talk about that honeymoon period where, they've waited during that period of potential fertility. And then when they're able to come together, when they've confirmed ovulation has occurred, it's like this, this honeymoon where they get to be and really appreciate one another again. So it's all a matter of perspective, but it's also a matter of information and realistic expectations. So I think it's really important, we don't sugarcoat these and say they're natural. And so natural is easy. I see that similar to breastfeeding. Breastfeeding is natural. And for some women, it's really easy, but for some women, it's really difficult. And fertility awareness-based methods, although they are natural, for some women, they may be easy, but for some women, it can be challenging, especially if she has irregular cycles or chronic discharge. But women with irregular cycles, with chronic discharge, with painful periods, any woman of any age, I strongly believe with the appropriate level of coaching and education can learn to chart her cycle with a fertility awareness-based method.
So Dr. Joy, can you tell us about your organization, factsaboutfertility.org?
Sure. So factsaboutfertility.org is an organization whose mission is to educate our medical professional colleagues about the science supporting fertility awareness-based methods and their role in women's health. And I started this organization because personally, I never heard the term fertility awareness or natural family planning or charting the female cycle or any of that until I was in my first year of my family medicine residency. I was a physician with an MD after my name, passionate about women's health. A woman myself, had been cycling for nearly 20 years before I ever heard about these terms. And I was just fortunate to be on call one night with a senior resident who was trained in one of these methods. And I think to myself, what if I had never met Dr. Pearl Huang Ramirez, who's a physician there in Florida? I might not have ever heard about these methods. And a decade later, I had an opportunity to teach a class to first-year medical students at Georgetown. And they were overwhelmed with this information and asked, why isn't this a part of our basic reproductive physiology curriculum? This is the most useful class I've had at Georgetown so far. This is something every medical student should learn. And I thought to myself, you're right. This is something every medical student should learn. So we created Facts to share this information with medical students and nursing students, other health professional students, so they could all have the facts about fertility, so they in turn could educate and empower their women and engage men in the care of family, of their fertility and for family planning purposes. So now we offer online webinars, virtual conferences, and an online elective that allows women and men to learn more about the use of these methods and how they can use these methods to educate and empower their patients. So it's kind of exciting because next Thursday, can I just say, is actually the 10th anniversary of our very first Facts meeting. So we're so excited to see how far we've come. Yeah.
So what are you doing to celebrate?
Well, stay tuned on social media. We've got a very exciting announcement next Thursday. We're going to talk about how we're going to celebrate in November. We had originally planned to hold a big gala at the beginning of October, but obviously that got postponed, and we actually are postponing it. We're going to do it next year in Florida, second weekend in October, so you can stay tuned for that. But for this year, we're going to do something special on social media to celebrate in November, and we're going to announce that next Thursday. So people can follow us on our Facebook page or on Twitter, LinkedIn, Instagram, etc. We'd love to have people follow and help us to share the facts about fertility awareness.
Well, definitely invite us. And what about for the crowd of people who, if they have daughters who want to learn this method? How do you have a referral system through the factsaboutfertility.org?
Well, one of the things we're getting ready to launch next Thursday is a database of FABM trained medical professionals and educators all across the country. So that's going to go live on our website next Thursday. For now, people can always email me at info@factsaboutfertility.org, and we can try and get them connected with a local practitioner or an educator who teaches online.
And if you're within North Florida Integrated Medicine, my private practice in Gainesville, we actually had a Creighton model trained practitioner. She went out on maternity leave, but we can refer you as well. We're pretty much connected into that.
Excellent.
Yeah. What do you think of all this, Dr. Anna?
Well, I mean, I think it's really fascinating. I think where it gets iffy is in the perimenopause, right? And when you're working through menopause, you've really got to understand your risks in this time period. We as women over around 54, have that occasional cycle still. Lucky me. There's probably an occasional ovulation to go with it, right? And so, I mean, we look at that, we look at those risk factors. I think that's really important to understand in this. And so, especially, I think the earlier we can start training our patients and our children, our daughters, in understanding your body, I do agree that cervical mucus is a fifth vital sign. Without a doubt, cervical mucus is a fifth vital sign. It's so important to understand what your body's doing. So, and that you can fix it naturally. Like if you're having PMS, to have girls who are 13 coming to my medical practice because their, moms want them on birth control pills to help with acne. I mean, this is the conversation to have. We know that starting birth control, let's go back to the research that we presented earlier, increases your risk of breast cancer. We know, especially the earlier you start. Now we're looking at all ages, and certainly over 5 years, there is a significant and persisting increased risk of breast cancer. And this is Breast Cancer Awareness Month. And I'm not hearing this anywhere. Like, hey, consider if you're not going for your mammogram, it's been a couple of years, let's reduce your risk by getting off oral contraceptives if you're not needing them for pregnancy prevention. And then let's think about better ways. What I was really fascinated by in this article, because I always say transdermal is better. We're going to reduce the risk of the consequence of oral estrogen, the inflammatory risk factors in birth control. But yet the Mirena IUD, levonorgestrel IUD, showed a significant increased risk. They did not mention the Skylar, which is lower dose, which I think that's a really good option. But they did not mention that. And then there's the non-hormonal, because, the Paragard IUD or copper T IUD, that's an option for birth control too, especially in the perimenopause, menopause, and using bioidentical progesterone, as Dr. Dwayne says. I know that both Dr. O'Neill Smith and Dr. Akey also do use bioidentical progesterone, regardless of what fertility method in the perimenopause and menopause, to help balance hormones when needed. I think that's a really important statement, as well as, okay, if the birth control pill is your choice and is the best option for you or your family member at this time, what can we do to reduce that risk of breast cancer? And that's an important discussion to have. So I want to bring that on the table. And I would say, as I learned the consequences of oral contraceptive pills, definitely not my first choice, but a choice still. And when I put a patient on birth control pills, I would accompany it by a very high quality multivitamin and mineral, so Albion micronutrients, chelated minerals, multivitamin combination with methylated B vitamins. I would add in an omega-3 essential fatty acid once or twice a day to reduce inflammation and coagulopathy risk factors. Again, the unknown, we're not checking 20-year-olds for von Willebrands, right? Or what are we checking them for? Factor 5 Leiden, are we checking them for any coagulopathies? No, we're just putting them on the birth control pill. If you get a clot, we'll stop it, right? So we're not. So let's use some, unless we know family history. I'm being a little sarcastic, y'all, but this is a hot topic. This is a really big issue. And so, using omegas, using magnesium, using methylated B vitamins.
Vitamin D? Vitamin D is in dog, Anna. Dr. Anna?
Vitamin D, absolutely. Yeah, also. And I think in herbal detoxifiers, estrogen detoxifiers, this is high dose estrogen and it's a synthetic progestin. So we want to support our body's detoxification. So there I'd throw in some Mighty Maca Plus, 1 or 2 shots a day, right? Scoops a day, or, you know, really focus on other things to reduce risk of cancer in general. So I think it's the perimenopause is a tough area when we're thinking, okay, well, you know, I definitely don't want to get pregnant again. And well, it could happen. I work with clients, you know, in their 40s and 50s going through the perimenopause transition and thinking, okay, what do I do? And many of them, when they go to their physicians, are told, well, we can just put you on birth control pills during this time. So again, to reiterate, I'm a big fan of the Paragard IUD. I think fertility, I think understanding your cervical mucus and being able to identify, you know, when you are fertile and when's your fertile time is critically important and fun to do. And again, knowing your body and improving it. But this perimenopause, I'd love to hear your feedback on this, you guys.
I think the two things is perimenopause, and then when women are young, when they're 12, 13, 14, those are the difficult, the beginning and the end of the difficult periods where we have some irregularity and there's a lot of other things going on, and there are other uses. In the perimenopause period, we're mostly using it for pregnancy prevention, but when you're young, we're using it for so many other things. And we know, in addition to clotting and in addition to there's also insulin resistance and breast cancer. So this is a very big issue. And I think one of the key points that you're right about, you know, Anna, and it's wonderful to have Marguerite here this time, is because no one is talking about this. No one. And this has to be talked about. But I think with respect to, it makes sense. Basal body temperature we use to follow our thyroid. We use for many other reasons. So basal body temperature, cervical mucus as your 5th vital sign is great. I think we've got to have other methods to know how healthy our body is and how otherwise we're just going to take a pill and we're going to get 5 other problems potentially from one pill. That, you know, it's crazy. It makes no sense.
Yeah, and really just teaching it in 7th grade, right? The Teen Star program, shout out to them, because had that woman who was infertile because she thought she had an STD had education, because
Right.
I taught my boys 7th grade science class about this, just about their menstrual cycle, and they were fascinated. They wanted to know all about it, and I don't know why it's not taught in 7th grade.
Right.
So.
And I agree. I mean, it's definitely more challenging, you know, using it in the perimenopausal period as your hormones are changing, but it can be very helpful too. I mean, I've had patients who charted all the way through perimenopause, and they can see, like, based on the changes in their signs, like, oh, looks like I didn't even ovulate this month. And they know, like, my period's probably going to be later. And, you know, it doesn't frighten them as much because they understand what's happening on the inside hormonally. You know, they recognize, oh, it must be that my estrogen levels were lower maybe this month, and that's why I didn't have as much mucus, and that maybe I probably didn't ovulate, and so I might get my period a little bit earlier if I'm not making enough progesterone. So they begin to understand, and those fluctuations that we experience at the extremes of our reproductive life, at the beginning and at the end, they become more manageable because they're not so unexpected. But it is more challenging, certainly, to learn how to use these methods as you get older and as your cycle becomes more irregular. That's why I really think in learning at a young age, before you even need it from a perspective of family planning, but just learning to chart, to understand your body, can be so empowering, and it can become a habit that women can just incorporate into their daily routine.
And I think all 4 of us on this call really want to be in concert with our body. I wrote this book in 2011. Dr. Anna reviewed it.
I know, I want a copy of it. I'm like, who wrote it? Oh, that's you.
So basically, this is in line with trying to be in concert with our body, instead of, you know, to me, putting birth control on a 12-year-old with acne is like not even going to the root cause, and permanently potentially disabling her testosterone for the rest of her life. I mean, epigenetically changing what this young lady is going to be like the rest of her life, or in just like it's not getting to the root cause. It's like if you had an abscess, not lancing it and giving it antibiotics, but just covering it with a Band-Aid, which is what we do
Right.
to so many women without thinking what the ramifications are. So Dr. Dwayne, you've been really insightful talking about fertility awareness-based methods. Thank you so much. Dr. Anna Cabeca, of course, world-renowned best-selling author.
Always making it real. I love that. Thank you, Anna. Thank you.
Dr. Cabeca, where are you in practice? Are you also in Florida?
No, I'm in Dallas right now, and I've retired my clinical practice, so I teach and educate and teach online as well.
Oh, wonderful. Well, I'll be in Dallas over the holidays, so we may need to connect. So
Definitely, let me know for sure, because I have my girlfriend doctor show, and we're doing some live interviews. So
oh, that's fantastic.
love to bring you on
fantastic.
to teach this.
So I have 3 bullet points to summarize for today, which was oral contraceptives and increased risk of breast cancer. Yes, there is an association. It was published in New England Journal of Medicine in December of 2017. Please review the reference if you'd like. Not talked about very much. Combined oral contraceptive is considered a class 1 carcinogen by the World Health Organization, in line with smoking. Fertility awareness-based methods are doable, and we've given you some resources. Dr. Dwayne is a great resource. And again, you're going to have a referral line of facts about fertility, which is great. And then just realize that you're truly fertile between 3 and 6 days out of a month, but to be cautious, 8 to 12 days. And yeah, I think those were my bullet points. Any bullet points from your end?
Well, I think it's tricky at both ends of the spectrum. And I think also, if you want to learn more, both from Dr. Dwayne and Dr. Cabeca, follow them. I mean, they have amazing learning opportunities for you. They're great teachers, and they make it really real.
Yeah. Thank you. Thank
you
you.
both for coming.
Thanks.
Thank you for having us.
Oh, it was so fun.
Thank
We
you.
really had a great time.
Amazing.
And for our audience, be safe, be well, and God bless you all.
Bless you.
Emily will wrap it up now. Thanks, you two.
Thank you.
Thank you.
Bye, guys.
Alrighty, that was so great, so informative. And now if you stay on, I will go over some supplement deals we have. Just as I mentioned last week and the week before, Dr. Anna's keto line is 10% off on our Get Healthy website. We have the Julva cream, the keto green shakes, keto pH test strips, Mighty Maca, and the Pure Balance PPR cream. This is available on our FIRRIMup Doctors Get Healthy store, and the 10% off code is FIRRIMup Dr. Anna. That is FIRRIM up DRANNA. So if you want to go ahead and take a screenshot of that, I'll leave it for a second. Next, we have the vitamin D pack, which is the micellized D3 and K2, as well as the D3 supplement pills. We have both 2,000 and 5,000 IU. Again, this is available on our FIRRIMup Doctors Get Healthy store on our website, and the code is FIRRIMup VITD, which is FIRRIM up VITD. Again, I will give you a second to take a screenshot. Both of these codes will get you 10% off any of these products that you would like to purchase. Next, we have our Kick COVID to the Curb Fall Flu Season IV Special. This is going to include 4 IVs and a Kick COVID to the Curb guidebook. If you would like any of these IVs, vitamin C, the Myers cocktail, or the glutathione, you can go ahead and send an email to firrimupdoctors@gmail.com, and someone will get back to you on more information on how to get set up with that. Next, we have our October special, which is if you buy our Kick COVID-19 to the Curb book, whether that's paperback from the office or an ebook online, you can go ahead and take 20% off vitamin C and zinc. Our ebook is always available for $10, $9.99 on Amazon Kindle, Google Play, and Barnes & Noble. All you need is proof of a receipt, whether that's a screenshot or a piece of paper, and we will go ahead and offer that for you. And our book is also available on our FIRRIMup Doctors website. And finally, the Fascia Function and Medical Applications textbook that both Dr. Akey and Dr. Kathleen helped to write. If you would like to purchase this, it is available. We have a few limited paperback copies available at the NFIM office for $55. This will be curbside pickup, And if you'd like to have this done, you can email us at nfimgmv@gmail.com and someone will get back to you on how to purchase that. But if you would like to purchase it online, you can also go to our website, FIRRIMupDoctors.com, and take 20% off using the discount code SCI20. This discount code works for both the the hardback and the ebook. We also have it available on Amazon.com, but unfortunately, these discount codes will not be able to be used on Amazon. So if you do want the discount, either go ahead and email us or go onto our website and that will be used. And as always, we are very, very thankful for everyone that joins us every week, very appreciative. Next week, if you join us, we will be doing our COVID update. So stay tuned for more information, and I hope everyone has a wonderful weekend.
We're so glad you joined us today.
We hope giving you the tools to take control of your health.
For more good medicine and information about any treatments, supplements, and resources discussed today, please visit us at www.FIRRIMupDoctors.com. That's FIRRIM updoctors.com.
And wherever you're listening from, remember to like us on Facebook and subscribe to our YouTube and podcast channels so you don't miss out. The information provided is not a substitute for professional medical advice. This should not be used to diagnose, treat, or manage health problems without consultation. If you do experience any of the symptoms discussed today, please contact your nearest healthcare professional.